Many professions are required to engage with one another in the routine conduct of their day-to-day work. For example, architects work with engineers and teachers work with social workers. Good interprofessional communication skills are essential. Yet, it is often the case that many of the skills pertaining to interprofessional working are learnt on the job. We developed a novel teaching session reflective of real life for undergraduate medical, pharmacy and nursing students. The students adopted the roles of qualified doctors, pharmacists and nurses and worked together in a simulated environment to establish the correct medicines for a patient discharged from hospital. What the students valued the most was the real-life nature of the task and the opportunity to work together to discuss and resolve a problem. Interaction and engagement in the tasks of a qualified professional were prioritised ahead of the simulated environment.
It's the communication side of things, to sit down and figure something out and then go through it with the nurse and the pharmacist. It's a very good learning experience.
It's nice to put ourselves in the shoes of a qualified nurse. It was quite nerve-wracking actually, but it's a good experience. Though the students perceived the task to be very simple and called for greater complexity, only 50% were able to perform the task correctly, and significant deficiencies in communication were identified. Though students were aware that they would be required to conduct a similar task as a qualified healthcare professional, it did not seem relevant to some as undergraduates, and they called for a formal assessment of what was being taught.
It's just not really a priority at the minute. We have 101 things to learn other than prescription writing.
Our conclusions are as follows. Having students adopt the role of a qualified professional is a useful learning experience. Advanced technology is not necessary to facilitate successful interprofessional learning. A simple scenario can afford valuable learning opportunities. Having students understand the importance of the real-world problem being addressed is essential, and a formal assessment should enhance relevance.